I've been very concerned lately with the ongoing cuts to care and what that means for patients. Just 2 days ago, I saw a patient of mine who came into my clinic after being discharged from hospital. She was having a hard time breathing in clinic, and when I listened to her lungs, I could tell they were filled with water. I told her that I thought it was best that she went back to the hospital. What she told me afterwards completely threw me for a surprise and completely shocked me. She told me that she waited 2 days in the emergency room, coughing, with loud noise, people screaming, machines going off, before she was able to go onto the floor and be taken care of. At which point she was eventually taken care of, started to recover, but felt some pressure to be sent home before she was 100% fully recovered. And that's probably because the ongoing cuts to hospitals and to patient care are forcing hospitals and physicians to get patients out of hospital earlier, and sometimes before they're 100% recovered. What she told me in that office that day after I asked her to go to the emergency room was that she didn't want to go, and she didn't want to be put through that same scenario. And that was a real eye-opener for me as a physician, that a very pleasant, lovely 70-year-old lady who was very sick decided that she'd rather go home and take the risk of getting sicker than to go in our emergency room in Ontario. I'm worried as we continue to make cuts to our healthcare system without the input from frontline healthcare workers, that patients will suffer most from the cuts to care. I anticipate that wait times will get longer for specialist appointments. I anticipate that emergency rooms will be clogged up, backed up. Patients will be waiting days in the emergency room before able to get a bed in the hospital. And doctors' offices will be forced to close as the government continues to introduce caps on the number of patients physicians can see annually. I think we deserve a better Ontario.